歡迎各位。
Welcome to today's press briefing on the updates of COVID-19. We have with us the Secretary for Food and Health, Professor Sophia Chan, Dr. Edwin Choi, Controller of the Center for Health Protection of the Department of Health, Dr. Chang Shok Kwan, Head of the Communicable Disease Branch of the CHB, and Dr. Larry Lee, Chief Manager of the Hospital Authority, as well as Mr. Ian Lok, the Assistant Director of the Housing Department. We'll hear from them about the different aspects of the update. Good afternoon, everyone. Together with my colleagues from the Hospital Authority, the Housing Department, we will give you update about actions taken in relation to Kwai Chung Estate. As you know, that there is a community outbreak in Kwai Chung Estate. The government has taken action against Yat Kwai House and Ying Kwai House in the form of a lockdown for 5 days for testing. There are also similar lockdown for testing action against other blocks for a shorter period, that is 1 day. On top of that, there are also mandatory testing notifications in relation to other residents. We have so far identified 170 confirmed or preliminary positive cases. As at noon today, there are 126 cases in Yat Kwai House, 41 in Ying Kwai House, 2 in Nga Kwai House, and 1 in Hiu Kwai House. There is also 1 case in Yuk Kwai House, 1 case in Chun Kwai House, and 1 case in Tin Kwai House. There are some cases involving staff members of local hospitals and those working in residential care home for the elderly, which is quite worrying. With more testing work done, we suspect that there will be more cases relating to Kwai Chung Estate servicing. In order to protect the health of residents and in order to prevent potential carriers spreading the virus to other places, triggering another cluster, we will proceed with the original plan of locking down Yat Kwai House and Ying Kwai House for 5 days. Early on, there were mandatory testings of residents and lockdown testing yesterday. It's assessed that the risk for Tin Kwai House, Nga Kwai House, Yok Kwai House, and Hiu Kwai House was lower. Therefore, the government will not extend the lockdown operation in relation to these 4 blocks. Residents may leave, but they have to, over the coming week, be tested on a mandatory basis every day. We ask them, that is, the residents living in these blocks, to closely monitor their health condition. And again, they have to be tested. It's advised that they should avoid going to places with high density of people. We appeal to other residents in Kwai Chung Estate to abide by the mandatory testing notice. They should go to the mobile sample collection center to get tested on time. We'll continue to monitor the situation depending on the changes in the situation as well as risk assessment. We'll decide whether to take other actions in relation to Kwai Chung Estate. In the same district, we have found a case with unknown source in Phu Kang House in Tai Wah Hau Estate. Investigation is being carried out to see if it's related to Kwai Chung Estate. We will increase the capacity of mobile testing stations in the district so that residents living in Tai Wahao Estate will be able to get tested if they so wish, hopefully to stop the transmission of the virus in the community. In view of the development of the spread in Kwai Chung Estate, we found that it's similar to overseas experience in relation to the spread of Omicron. In overseas countries, the transmission of Omicron cases increase at an exponential rate. In Hong Kong, we see an increase in transmission of cases of Omicron. So far, it's not at the rate that is exponential, but we will continue to conduct risk assessment. Apart from the effective measures put in place by the government, I think that is also supported by the cooperation of the residents. We would like to express our thanks and to hopefully continue to get your understanding. Your support is most important in the protection for yourself, your family, and the general public against the further transmission of the virus. I would like to appeal once again to all of you that you should remain vigilant. Exercise good discipline in relation to personal hygiene and get vaccinated as soon as possible. That is especially so for those who are exposed to high risk, including cleaners, security workers, those working in nursing homes, residential care homes for the elderly, and for the disabled. The government will provide free voluntary testing for the groups I've mentioned just now. There is an increase in demand for testing. Even though we have increased the availability of mobile testing stations, the waiting time may still be longer. We ask you to understand. If need be, we will increase the number of mobile testing stations. I appeal to members of the public to reduce social activities that includes cross-family gatherings. We should work together to face the challenges. Let's now hear from Dr. Zhang.
So we got 140 positive cases last night, of which 15 were imported cases. And there were 125 locally infected cases. They included 94 cases at residents at Yak Kwai House or friends who stayed there. And there were also one case at Ah Kwai House. Ying Kwai House had 9 cases. Of the other cases, 17 were related to the other cases, including one on January 7th in Tung Choi Street. Little Boss is someone who bought a hamster there. The genetic analysis showed that it's of Delta variant, so L452R variant. And there were also cases related to family members. One was in Town 7 Caribbean Coast. 3 were at the Buddhist Faho Primary School related cases. And there was one who went to the Star Seafood restaurant in Sai Ying Pun. And another case, 13110, family member. And there are 2 cases involved in the students or family members of infected patients at Lee Chang Uk School. In Faho School, there were 3 cases. Buddhist Faho Primary School. In Jiangshan Estate, a construction site at the school, there were 2 related cases. So there was a transmission there, apparently. So some people from the school would need to be quarantined. In Kwai Hing Mannings, there was a resident from Yak Kwai House who worked there, and another person there was also infected. So there was a cluster there. So people who have been to the Mannings at Kwai Hing would need to be tested, and the colleagues will need to be quarantined. There were also cases involving family members, 13107 or 13103. Those were actually cases with unknown sources. And there's also cases involving family members of someone who went to the Dragon Place restaurant, and also a PSA at Princess Margaret Hospital, who was related to a case at Ying Kwai House. They were colleagues indeed. So far, for the unknown cases with unknown sources, there were 4. 13155 is one of them. As I said, it's an 18-year-old who goes to Dahlia Memorial School, who lives in Tower Hau Estate. And there's another one, 13163, who's a 6-year-old child who lives in La Rosa Red Coastal Skyline, Tung Chung, and the kid spent much of his time playing in the playground. And also 13257, a 31-year-old female who's not working, who lives in Tai Wai, Pictin Street. So far, we didn't know of any other related details. And 13182 is a 44-year-old man. The genome analysis showed that it's of L452R. And he's a escalator repairman who actually lives in Sankong private residential block. And for the previous cases, including members of staff at the Evergreen Nursing Home, more than 50 people from the home were sent to the quarantine at AWE. They were being cared for there, and they will undergo testing as well. And there's also one case from the Sansan Rehabilitation Home, a resident there, and people who lived with the resident there, about 10 of them would need to be quarantined as well. We also have a cleaner who actually worked at an elderly home run by a Salvation Army, and he is a preliminary positive case. People who ate with him would need to be quarantined, and the person was responsible for cleaning and didn't have much direct contact with the residents at the elderly home. But the residents at the elderly home would need to be tested. For preliminary positive cases, in the warehouse of Mannings, there were 2 related cases. One lives in Ying Kwai House, and the other one could have been infected by him. And there's also another case of a person, a staff from Keling, who undertook testing for others, and he's preliminary positive. There's also a case at Ying Kwai House. He worked at the construction site at Sing Hing Street, and he was involved in doing works for air conditioners, so he could be related to the Kwai Hing or Kwai Chung Estate cluster. And for the Star Seafood restaurant, we are looking for more details, and we found that people who were affected in the restaurant did not sit close to each other. They were either sitting on the right or left-hand side of the first infected case. So I call on people who have been to the restaurant during the particular time frame should go for testing. So that's the end of my report today. So Dr. Lee, the HA by 9 a.m. this morning, in the 24 hours, there were 104 reported cases. Altogether, 31 patients in the past 24 hours were discharged. Altogether, 12,572 patients have been discharged. By 9 a.m. this morning, there were 324 patients in hospitals still undergoing treatment, including the suspected cases. There were 434 patients. They are under treatment at the North Lantau HA Infection Control Center and also Community Rehabilitation Complex at Asia World Expo, and 5 public hospitals receiving treatment. The condition is stable. I also like to report about 2 cases involving family workers. One actually is now undergoing treatment at Prince of Wales Hospital. It's a 50-year-old family worker who worked actually providing domestic services for households. And that person actually is responsible for a cleanup at surgery rooms. And he went to work on the 19th, and on the same night he tested negative. But by the 20th of January, he had sore throat and muscle pain, and he went for treatment at a private clinic, and he was not tested then. By the 21st of January in the morning, from 7:30 to 10 a.m., he worked in the surgery room, and he did not undergo any high-risk medical procedures. He also was in proper PPE. We had done some contact tracing, and the staff concerned, he had none of them actually were his close contacts, but 6 patients who were listed as his close contacts were tested. And we've also arranged for 140 staff to go for testing. So far, 18 were negative. As for the operating or surgery room, actually has been disinfected. Another patient care assistant was also preliminary positive in Princess Margaret Hospital. It is a 53-year-old person who provides assistance to patient care, and he lives in the Kwai Chung estate. And on 16th, he actually went to for a get-together, a mealtime with another infected person at Chou Ying estate. And his saliva sample and also his rapid antigen test both show positive results. So he went for treatment at ADND department at Princess Margaret Hospital last night, and it's now being isolated and undergoing treatment at our Asia World Expo Community Treatment Center. And on the 18th, he carried out some procedures, but he was wearing full PPE and did not undergo any high-risk or undertake any high-risk medical procedures. We found that in the pantry room, he had chatted with a 53-year-old colleague, and they took off their masks during their conversation. So the assistant concerned was classified as close contact. 2 other patients were also classified as close contacts. There are also 18 other staff members and 2 patients who were classified as other contacts, and they will be actually given testing, and the hospital concerned will be thoroughly disinfected. In Kwai Chung, there was a Chinese medicine clinic who had actually received a patient, and actually the patient concerned had been to the Chinese medicine clinic and teaching center associated with Yanchai Hospital, and so on Monday the particular clinic will only provide actually limited services and will only have colleagues who test negative to go to work, and the teaching center and clinic concerned will be totally disinfected.
It's now the question time. Please use the microphone. Identify your organization and keep your questions to under 3. Anyone? The gentleman over there. I'm from Commercial Radio. I'd like to ask about other blocks in Kwai Chung Estate. There are infected cases. What's the risk assessment? Did you conduct any investigation as to the route of transmission? Was it the cleaners who went everywhere to clean? Was she the source, or there are other transmission chains? Just now you mentioned about a preliminary case. It's a patient service assistant. There was a gathering involving 2 people. Was the other person also a patient service assistant? Are there any other people in the gathering? Any staff members of the HA? So in relation to that case, where did that person get tested? Because you mentioned that there's someone working at testing facility who's got infected. So where does that person work? And what about the risk involved? Well, different panelists will answer different aspects of the question. Thank you. In Kwai Chung Estates, there are a number of investigations being carried out. For Yak Kwai and Yin Kwai houses, there is the lockdown of 5 days for testing. It's because we have identified quite a number of cases in these two blocks. There are 126 cases in Yak Kwai House. Compared to yesterday, 96, there is an additional 30 cases. In Yin Kwai House, we identified 8 yesterday. In the mandatory testing operation, we have identified an additional 30 cases or so. It's the same as what we've observed. These cases are scattered over different units on different floors. In our investigation of the environmental samples, we have identified quite a number of contaminated samples. It's very likely that 3 or 4 days ago there was the presence of a source of infection. Perhaps it's someone who worked on different floors and infected residents. Perhaps it was other infected residents who have contaminated different areas of the communal places, say for example lift panels. So it's more the case that residents have been infected and then they in turn spread the virus. In addition, we have to carry out investigations as to the structure of the block, say for example in relation to ventilation and drainage. We have engaged experts to carry out a field investigation at Yak Kwai House. We've ruled out that possibility. So looking at the chronology and the environmental sample, it's likely that a few days ago there was a common source of infection. We have gathered data for a few days for Yak Kwai House, but for Yin Kwai House, we've only obtained 33 cases yesterday. We'll have to wait and see if there is any sharp increase of number of cases for Yin Kwai House. For Yin Kwai, Yok Kwai, Chin Kwai, Hiu Kwai, and Chun Kwai, we have conducted testing of over 2,000 residents in each block. We found 2 cases in Yak Kwai House and for the others 1 case. It seems that these cases are the result of interpersonal contacts. We have not seen any large-scale outbreak in these blocks, but there will continue to be more cases during the incubation period. So residents will have to follow the mandatory testing notice and get frequent testing. In relation to the 2 patient care assistant, it's a gathering involving 5 people. So it's from a family. So for HA staff members, only 2. For the sample collection staff members, that person went to the went to Cheng Yi Mobile Sample Collection Center and another center. That person went through frequent testing. The CT value is about 35. We reckon that is the onset of an infection. That person worked at different high-risk places, so the infection risk is higher. It's more like that the person was infected by others. That person lives in wheelchair house, and he has lived in a Panda Hotel. When that person worked, he was fully equipped with protective gear. So it's a very small chance that that person will infect others. From AM 7:30, I would like to ask about 13168. That person lived in Kwai Chung Estate and a hotel. Was it someone who left after the announcement of a lockdown? Well, how many such residents have you identified? Residents said that there are a big group, a number of people waiting to get tested. And just now, Dr. Choi talked about contamination of communal areas. Is that a risk? In relation to Glee Path, is it related to the teachers or is it related to Tai Wo Hao Estate? For the Manning's cluster, can you give us the case numbers and the transmission route? Does it involve a custom and excise officer? Just now at about 1 o'clock, it was said that there was a positive case in relation to hamsters. What about the owner? And for the Namshan nursing home confirmed case, was it something to do with a previous case? In relation to control of people, apart from the mobile stations at Yak Kwai House and Yin Kwai House, and there are also another about 40 or so mobile stations. We try to scatter them as much as possible to reduce the number of people gathering at the same place. We'll closely monitor the queue if there are long queues. We would remind residents to maybe wait before they go to the sites to queue. Well, just now someone asked about people taking the lift downstairs to get tested. It's something that they have to do. They have to take the lift. And people are anxious to get tested. Just now, as Mr. Luk said, that everything will be done in an orderly manner. Well, people have to take the lift to go downstairs to get tested. What's important is disinfection. So disinfection and infection control is very important too. I'll defer to Dr. Choi. The housing department has swiftly disinfected the areas. Well, we have identified environmental samples carrying an abundance of virus, so disinfection is very important, and that has already been done. But we can't prevent possible infection by those infected onto communal areas, because we see constantly new cases. So we ask you to exercise good discipline. Keep washing your hands. Don't touch your eyes or your face with your hands unless you have disinfected your hands. Do so before you eat. But still, people have to leave their home to get tested, so they will go past communal areas, so they need to be sure that their hands are clean.
For the overall arrangement, we have to make sure that we can have better control for people flow. There's a risk involved with people's gathering, so we will monitor the situation. And for residents in Kwai Chung Estate, and particularly for those who are not required to go for compulsory testing or not involved in lockdown, they may be anxious and they want to be tested as soon as possible. In Kwai Chung Estate, the government has arranged for 7 points for testing to be conducted. So the residents, please take note of where the testing sites are, and they don't need to rush to the sites. They just need to actually go for testing in an orderly manner so as to reduce large groups of people gathering. For 13155, that case, we need to look at results of genome sequencing to see whether it's related to any other cases. Our preliminary understanding is that one of his family members is colleague of another case, 13132, but the family members were not yet confirmed cases, so we need to carry on more investigations. The family members of the positive case of hamster, they have been quarantined, and we don't have results of the testing yet. 13168 case, on January 21st and 22, they stayed in the Nina Hotel in Chinwang. For the Manning's shop, right, or the warehouse, which one are you referring to? I wouldn't comment on particular professions, but in the warehouse of Manning's, there's one resident in Yak Kwai House, or Yak Ying Kwai House, and then he may have infected people in the warehouse, and also there's also 2 staff at the Kwai Hing station, Manning's at Kwai Hing station have been infected, and one lived in Yak Kwai House. This lady in red.
CMP News, a few English questions. There was a media report of a 70-year-old man testing preliminary positive, but his family members have complained that they have waited half a day for him to be sent to hospital at Kwai Chung Estate. I'm wondering, how are the authorities addressing this issue, and is there any risk for the residents whose family members have been confirmed cases and then now they are at risk of getting infected? And also, another expert has suggested a 2-mask rule for the Kwai Chung residents who are, if they have to come up for testing, they should wear 2 masks if they are taking leaves, etc. I'm wondering if the authorities would also issue the same advice to these residents and to the public in general. And my last question is on social distancing. Are there any plans underway to extend the measures, since given that the CE has not been optimistic about reopening by the Lunar New Year? Thank you.
May I invite Professor Chen to answer the questions on social distancing first, and then Dr. Choi on about the mask issues in Kwai Chung Estate.
Okay. First of all, thank you for your question. Regarding social distancing, obviously now we are in the middle of a community outbreak in Kwai Chung Estate, especially some of the selected buildings. So I think obviously we are now advising, everyone to better not go out, and we want to vastly reduce, because other than this Kwai Chung Estate outbreak, actually there are still unlinked cases in the community, and there are also in other areas. For example, some of the sewage study that we have found on and off positive, sometimes negative. So we are actually trying our very best to actually look into all these different areas and try to control, the epidemic as far as possible. So we obviously do not want more people to go out. We actually want to reduce the people flow. So I think it is now too early, to see if, the social distancing measures can be relaxed or even further tightened. So we'll continue to observe, the situation and also monitor the situation. But right now the focus is more on controlling community outbreak and also cutting community transmission chains.
Okay, so regarding your question about use of mask, so I know that some experts advise to use an N95 mask in some general setting, but indeed using an N95 mask is more efficient to prevent the airborne transmissions, but at the same time, the users may have difficulties in breathing for a prolonged period of time of using it. So at present, we still suggest to use a proper use of mask in the daily setting and to observe a good personal hygiene and hand hygiene. So if someone has to use a N95 mask, he should aware that he can't use a prolonged use of the N95 mask in these social settings. So for the transferal of symptomatic case to hospital, all along we have a arrangement with the fire service department and also the hospital authority for the transferal. So for this particular case, which complains of some delay in transfer, we have to investigate matters.
Are there any other similar cases of similar cases of related to the 70-year-old and other similar cases of people not being able to go to the hospital?
So at present, I'm not aware of any particular case of delay of transferal, but there are some times that we have to arrange an ambulance for the transferal, and there are some special requests of the families for the referral, because for one living alone, sometimes they have to arrange the management of the pets at homes, etc. So for this particular case, maybe we have to investigate the root cause of whether there's a delay in the transferal. But at present, we have a standing arrangement with the ambulance and also the hospital authority colleagues.
下一條，呢邊中間位女士。
你好啦，新聞台。
Next question, I'm from Now TV. Asking about Kwai Chung Estate. There are some close contacts who waited for half a day before they were sent to hospital. So how come it takes so long to send someone or affected residents for quarantine? Is it that there are not enough quarantine places? Are you going to have the residents being stuck in their homes for long? And also for the Tower Health Estate, Fukang House, the resident there, have you found that is there any link between the case and the security guard at the Yakwai House? And also you said that you're not going to offer testing for elderly people at their homes. Is that correct? And also for today's cases, for the construction site at Shangley Road, how many cases were there? Is there an outbreak at the construction site concerned? And also at the other case, the New Life Psychiatric Rehab Association case, what is the CT load of the case concerned, and what is the source of infection? And are the residents there or the staff being quarantined? So I think Dr. Look can ask the other question concerning collecting samples from elderly people, and Dr. Chuang can also give more details on other cases. To transfer residents out of their home, there are two possible scenarios. That is, well, of course, we need to arrange for suspected confirmed cases to HA hospitals or treatment centers for treatment. Transferring such residents into those places is easy because together with the fire service department, we have a mode collaboration with it to get the person involved sent to hospitals as soon as possible. Sometimes when the ambulance arrives, the patient concerned may need to make some arrangements first before he can get on the ambulance. Another case scenario is the close contacts who might need to be transferred to hospital as well. For example, the family members of an infected person, they may need to be sent to quarantine. So all along, our long-standing arrangement is that for close contacts at home who need to be sent to quarantine, we'll transfer them to those quarantine centers.
We'll need to find transportation and the auxiliary medical service to send the close contacts to relevant facilities. Sometimes it will take time because arrangements will have to be made. The most often case is that if there is a pet, we need to arrange for the pet to be taken care of by other family members. At the time of the quarantine, the stay will be longer. Currently it's 14 days. So sometimes home contacts will need to pack, which will take time. So in terms of transfer, it's going as expected. For some cases, it will take longer to get packed. We will monitor the situation because we wouldn't want it to take too long to transfer the person to a quarantine center. But that depends on manpower, availability of transportation and units in the quarantine center. So far, they are all sufficient in relation to Kwai Chung estates. About people who are mobility impaired, we will, as far as possible, arrange for samples to be taken at their home. But the contractor has a huge workload. Some requests will have to be kept waiting for a bit longer. Dr. Zhang, the construction site at Shenglei Road, there is one confirmed case and at least one preliminary case. There may be a couple of cases when we need to look into it further to see. Well, in relation to the care home is an inmate. Those who are sent to quarantine center are also fellow patients. For 13155, well, it's a security worker working in Taiwan House Estate. It seems that that person did not go to Fukang House. For 13155, a family member was a close contact with the previous case. We will need to wait to see if it's related. So the construction site is at Victory Avenue. That residential care home person has a family member living in Yak Kwai House. I don't have the CT value of the case. Next question. The gentleman in green over there. I'm from Hong Kong 01. We've received complaints from residents saying that they've been waiting for half a day and still the person who is preliminary positive has yet to be sent to quarantine center. It's a preliminary positive case, but how come they're kept waiting for half a day? It seems that, there is another wave and you're still not prepared. Is it possible to shorten the time they have to wait before transfer? I would like to ask about 13282. It's a lift repairman. Where has that person been? And the preliminary positive case is engaged in lift work. Well, the locations he's been, is it high risk? About Star Seafood, Dr. Chang said that, more investigation has to be carried out. How far are the tables? Is it likely that a recurrence like that of Moon Palace will occur again? Dr. Choi, transfer time, there is a mechanism in place. When we identified a preliminary positive case, we would like to send them to hospital as soon as possible. First, to reduce transmission risk, and second, to provide treatment as soon as possible. For those who live in the same place, they go to quarantine centers and not hospitals, so the arrangement will be different. From the information we have, the number of cases in Kwai Chung Estate, the number was not too high. Yesterday, there were 30 additional cases in Yak Kwai House. For Yin Kwai House, 33. So it's not a high number. We have sufficient capacity to deal with that. For certain particular cases involving a longer delay, we'll need to look into it. But from the information we have, the mechanism in place is sufficient to deal with the number of cases. Star Seafood and Roasted Goose Restaurant. It's about 12:15 to 2:15 on the 17th. They were seated at an approximate time, one on the left, the other on the right. We need to conduct a site visit to see how the size of the petition, or is it the case that there was contact while they were waiting to be seated? We'll look at the CCTV footage. Preliminary positive case is someone who is a lift repairman. He's recently been to Wong Tai Sin, a lobby of a private residential complex, and a few days ago, 2 residential blocks as well as the shopping mall in Shan Po Kong. I'm from TVB. I'd like to ask about Kwai Chung Estate. We see that for Nga Kwai House and Yok Kwai House, there are preliminary cases. And you said that there is a possibility of cases increasing at an exponential rate. What is the criteria for a 5-day lockdown? Currently, there is a lag. Some residents might still go out or go to work. For Yak Kwai House and Yin Kwai House, the hygiene situation. According to some residents, there are rubbish piling up on different floors. Have you arranged for rubbish collection and cleaning? Well, as you've said, that when people leave to get tested, they have to take the lift, they have to go past communal areas. Is there a risk of infection? Is there a chance that residents of the entire blocks will be infected? About hamsters. Well, do you know which branch did the hamster come from and how many people have come into contact with that owner? For the outbreak at Kwai Chung Estate, there are over 140 cases. Is there any need to further tighten social distancing measures or use new measures to tackle this new situation? Perhaps we'll hear from the Secretary in relation to the first and the fourth question. And then we'll hear from Mr. Luk about Kwai Chung Estate and Dr. Choi in relation to transmission risk at lift and hamsters. Thank you for your question. First, our focus at the moment in relation to Kwai Chung Estates is the outbreak at Yin Kwai and Yak Kwai houses. The number of cases are on the high side. We have at the moment imposed a 5-day lockdown and mandatory testing. We will closely monitor the results of testing on a daily basis. Just now, Dr. Choi explained that in relation to the other 4 blocks, we have imposed a lockdown for mandatory testing. We have identified 1 cases in these blocks and 2 for Nga Kwai House. By comparison, the risk involved is lower, but still we're concerned. After we have conducted the lockdown testing, we ask residents of these blocks to refrain from going to places where there are a lot of people, even though they will have to go on with their lives. In addition, they have to pay attention to their health condition and observe good hygiene. They also need to get tested every day for the coming 7 days. Well, there is a mandatory testing notice covering the entire estate starting from today. We'll monitor the results of the tests. For the other blocks, we'll make assessments to see if it's necessary to take further action. For the entirety of Hong Kong, there are different areas that we are working on. For Taiwan House Estate, there is a case in Fukang House. We're conducting an investigation into that case. We ask residents of Taiwan House Estates to get tested. It's on a voluntary basis. If people are concerned, they should get tested. Secondly, our experience told us that there are certain occupations that are high risk. That includes cleaners, security guards, those who work at residential care homes for the disabled, as well as nursing homes. So for this group, we offer them free voluntary testing. We ask them to get tested as soon as possible. Thirdly, there are still some unlinked cases. Of course, the contact tracing office of the CHP has been working round the clock to track the cases, but still people have to be vigilant. The case at Taiwan House Estate is of an unknown source. I ask everyone in Hong Kong to stay alert. If you are concerned, well, as Dr. Choi said, you should observe good hand hygiene. You should wear your mask properly. Don't let your guard down. We will continue to monitor our sewage testing. It's conducted at different locations every day. If there are positive cases, we will conduct contact tracing and issue mandatory testing notices. Say, in Aberdeen, that's what we've done. We identified positive results in the sewage. So we asked the residents there to get tested. We have identified quite a number of cases from mandatory testing, so it shows that it is an important means to control the infection. We ask you to get tested, whether it is on a voluntary basis or mandatory basis.
Mr. Look, I hope all of you can understand that in Kwai Chung Estate, at the same time, there are 2 blocks of building which are actually locked down, and this is unprecedented. And residents there have to go for testing. The cleaners working in the estate their contractor actually has hired a number of workers, and all of them have been quarantined, so they cannot report for duty anymore. And that's a fact. The actually cleanliness of the estate. And we have strived to actually arrange for a new contractor from today onwards. They will provide cleaning services at the estate from today onwards. So the situation has improved. And we've taken follow-up action. We'll continue to do our best to actually get the work done. Let me respond to your questions about our indicators and contamination of lifts. And then Dr. Chung can elaborate on the investigation of the cases of hamsters. Our actually work comprises 4 stages on the whole. We need to get people to go for testing on a voluntary basis. That is, people who are in places of low risk, and we hope that residents there can still go for testing to identify cases. We also have the compulsory testing notice in higher risk areas, so that through compulsory testing on designated days, we can identify more cases. Should there be an even higher risk involved in a district or location, then there will be a compulsory testing notice or lockdowns. So some cases are found as a result of the lockdown. And if there are more cases found and you're worried about even higher risk, then we will carry out a actually multiple day lockdown. So we don't have a hard indicator on when we should move on to the next stage, because in each investigation there are lots of factors at play. And for example, in Hiu Kwai House or R Kwai, Ying Kwai House, Yak Kwai House, for these buildings, why do we impose a lockdown on these buildings? Because there are so many cases in Yak Kwai House. And since these houses are adjacent to one another on the same podium, so the risk of them is quite high. So for lockdown and compulsory testing, we don't have hard indicators on when to escalate our action. So, and there could be also cases that are linked. Even if there are 2 cases in the houses found, that doesn't mean that there could be a serious connection. But for cases involving different stories and positions, then if that happens, then there could be a risk of large-scale transmission, and that could lead to a lockdown of several days. So your question on for people leaving their homes, would they, when they're taking the lift, increase the risk of infection once they're out of their flat? Coming down, for example, to the lobby. Of course, once you're in contact or at a place with other people, that could be a risk, and therefore we need to have total thorough disinfection of the areas, and the individuals concerned should have proper hand hygiene. And in our latest action, for people to leave home to do testing, the risk is already controlled, because if we don't impose a lockdown, then if there are more gatherings of people from the same building involved, and the risk will be increased further. So our latest action has minimized the risk of infection. This is, some sort of infection control, but it doesn't mean that there's zero infection. So we expect people to leave their home in an orderly manner to go for testing downstairs, and people should be cautious. Dr. Chong, for the confirmed case on January 7, on that day, he bought the hamster in Tung Choi Street, number 142. He lives in Shenzhen, a residential estate, and he works in Sampo Kong, industrial building in Sampo Kong. His close contacts were his family members and his colleagues and people who ate with him. For AFCD, it has transferred a case, a positive case, and did you mean where he bought the hamster? Well, I don't have the information for another case. Yesterday, there was a case who bought a hamster on January 4th, and he bought at the same place. Okay, last question, this lady over there.
Given what you're seeing at Kwai Chung Estate right now, what's the likelihood that the authorities have to conduct a 5-day lockdown for the whole estate? And do you currently have the manpower and resources readily available for such a mass operation? And my second question is, how sustainable do you see such lockdowns is, given the rapid spread of Omicron in Hong Kong, and also, looking at overseas experience? And regarding one of the latest cases, one of them is a worker who helped take swab samples in those mandatory lockdown operations. Can you give us a little bit more details, and also any indication that the current protective gear for people working in high-risk areas like this person is not enough to protect them, given the rapid spread of Omicron? And also, can you also explain whether the current precautions taken by the normal regular citizens is enough, with some of the experts advising wearing 2 masks? Thank you.
May I first invite Professor Chen to answer questions on our response measures, and then Dr. Chuan on the cases, and Dr. Choi on the use of masks.
Okay, thank you for your question. I think all of the measures, especially the measures that we have put on recently about compulsory testing, the different measures, for example, voluntary testing, compulsory testing, the restriction testing declaration that is restricting the movement, and most recently, with this restriction testing declaration for a period of not only 1 day, but 5 days. Now, this is all about risk assessment and also risk control. So we will, of course, assess the risk. Our Center for Health Protection, our public health authority, with different factors, looking at the number of confirmed cases, the environment, and also different other developments of the cases, to assess the risk, and also to issue whether we need a restriction testing declaration just for the day, or a longer period is required. Obviously, how sustainable? Well, yes, we all know that Omicron actually travel very fast, and the way that we are trying to do is still, containment. And we can see, if you can see the situation in Hong Kong, although the numbers are increasing, but we still have not seen a so-called exponential. But obviously, it may be too early to say now, because we still have to review the results of our compulsory testing, and also our RTD, for 5 days, the everyday result, taking Kwai Chung Estate as an example. So we still have to look into those before we can actually say that. But right now, we think our compulsory testing and also the different levels of compulsory testing are effective. We are able to, lock down people from spreading the virus, and identifying the cases, and sending them for isolation in the hospital, and sending their close contact for quarantine. So we'll continue to work on this. But of course, if there are other outbreaks in other areas, or within the Kwai Chung Estate, obviously we do not preclude any further actions.
Dr. Chuan, please.
I think this is indeed a very high risk job. Because of the job nature, they will wear full PPE, but it still require meticulous putting on and removal of the PPE. In case if there is any lapse, there may be a possible infection. So one of the method to early detect these cases is by very frequent testing. So she undergoes very frequent testing almost daily. So she developed a bit of sore throat on 22nd and then went to the hospital and get tested. And the CT value is very high, it's CT 35. So we believe if the case is confirmed, it is she's likely to be suffering from very early infection. So of course, reinforcing infection control measures and the way to gang and degang PPE is very important, and also the vigilance.
So for your question about the personal protective equipment, so at present there are lack of international consensus of the use of N95 masks in a domestic setting. So we'll keep in view any latest scientific evidence or advice on using a N95 mask in the domestic settings. But indeed in some specific activities, in particular high-risk activities like for those healthcare professionals and also staff working in some high-risk area like airports, we have different requirements on the PPE, like wearing surgical masks or face shield or even N95 masks in some settings. So at present, our recommendation for general community setting is a proper use of surgical masks and also with a good hand hygiene and use of hand sanitizers.
今日記者會結束，多謝各位。
That's the end of today's press briefing. Thank you. The press briefing has ended. We will give you supplementary information. Thank you.